Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. We're going to be speaking with returning guest Dr. Thomas Jones this morning, professor of pediatrics and adjunct professor of medicine at the University of Washington School of Medicine, director of the Cardiac Catheterization Laboratories at Seattle's Children's Hospital, and as an investigator on the Medtronic Harmony Transcatheter Pulmonary Valve, or TPV valve, pivotal trial. He's joining us to talk about the one-year outcomes from the pivotal trial and discuss a bit about the 30-day outcomes from the continued access study that was presented at SCAI. Welcome back to Health Professional Radio, Dr. Thomas Jones, and thank you once again for returning.
Well, thank you, Neil. It's a pleasure to be back on your show.
Well, I mentioned, of course, you've got you're wearing quite a few hats. Why don't you give our listeners who may not be familiar with you as a contributor a little bit of your professional background and talk briefly about your role there as a professor of pediatrics and adjunct professor of medicine at University of Washington.
Well, thank you, Neil, for that kind introduction. My career focus has been in the world of congenital heart disease management, both in children and adults. My focus for many years has been on less invasive treatments for both children and adults with these treated congenital heart conditions. One of the most gratifying accomplishments in the history of medicine has been the development of therapies that allowed children born with even complex congenital heart disease to survive not only childhood, but thrive well into adulthood. But many of these patients require additional care as time goes on. So our focus in the recent past has been to shift our thinking to the lifetime management of patients born with congenital heart conditions that survive into adolescence and adulthood. Many of these patients require treatment of their pathway between the heart and lungs, what's called the right ventricular outflow tract, and require replacement or establishment of a pulmonary valve in that position. And that's what the Harmony valve is designed to do in a much less invasive form.
Is it already FDA approved? Are we in trials?
The Harmony valve just received FDA approval in March of this year, based in large part on the information that was generated from the Harmony investigational device exemption study and the continued access trial that I reported results on recently at the Society for Cardiovascular Angiography Interventions scientific meeting.
Let's discuss some of the highlights of the data that was presented there at SCAI.
Happy to. The results of the that I presented were the data derived from the original pivotal trial and the continued access study. So there were a total of 67 subjects that were implanted with this valve over the past several years, and we then presented the follow-up data from those patients that had completed at least 1 year of follow-up in the pivotal study and over 1 month of follow-up in the continued access trial. What the data showed was ongoing safety and effectiveness of the Harmony valve implants. None of the patients required an explant of the transcatheter valve implantation. There were no episodes of infection, what we call endocarditis. No patients had any major stent fractures of the Harmony valve frame that required intervention or surgery. And there were no episodes of valve thrombosis, the valve clotting, and no subjects died during that period of follow-up. Over 90% of the patients that we followed had no or just trace pulmonary valve regurgitation or leakage of the Harmony valve at any point in their follow-up. Several patients did experience some heart rhythm abnormalities that were noted shortly after valve implant. But all of those resolved within days or weeks after the implant, and none were clinically important, none required any sustained medical treatment or other interventions.
When you say none required any sustained, there was some, or it just was alleviated on its own, it just disappeared?
That's right. When the valve is implanted, a portion of the valve frame has the potential to contact the working heart muscle in the right ventricle, and that can cause basically a tickling of the heart muscle that can result in an irregular heartbeat, but we never saw any of those last. Those all resolved as the device settled in place and the patient or the heart became used to the presence of the implant, and none resulted in any requirement for sustained medication or any other more advanced intervention to manage.
Positive results across the board, it seems. What was the most surprising reveal?
The thing that, personally I was most surprised about is just how versatile the Harmony valve frame is in adapting to the variable anatomy that we encounter in patients with these treated congenital heart conditions. There's a wide variety of shapes and lengths and various features. These pathways between the heart and lungs in these patients are almost as unique as their fingerprints. And so having a device that is able to accommodate that pathway in the majority of patients has been really surprising to me, that it's adapted as well as it has to the various anatomy we encounter.
Obviously, what does this mean as far as the practitioners and the patients going forward?
Yeah, very good question, Neil. The opportunity to less invasively manage patients that have already undergone at least one open heart operation in their lifetime and are facing a series of repeat open heart surgeries has been daunting, both for the physicians caring for these patients and, of course, for the patients themselves. So to have a much less invasive way to preserve heart function and do that in a catheterization procedure as opposed to a repeat open heart operation has been gratifying and certainly well embraced by patients. Of course, we had to demonstrate the safety of this procedure, and when compared to the historic experience with open heart surgery, there's clearly a safety benefit. That even becomes more amplified as the patients age. And the Harmony valve can be used at any point in a person's life. In the clinical study, we implanted the valve in a patient as old as 74 years. So there's really no upper age limit to who could benefit from this therapy. The other thing that the Harmony valve frame provides is a landing zone for future transcatheter heart valve implantations. So we expect, as we have with the surgically implanted valves, that over time these valve leaflets will degenerate. They're not living, growing valve leaflet tissue. So in time, we expect them to begin to either become thick and obstruct blood flow or begin to leak. And at that point, we have an opportunity then to go back and place a second valve within the existing Harmony valve frame in another catheter-based procedure. So the idea is that we can iterate this treatment over many years and significantly reduce the lifetime burden that these patients face of repeat open heart surgery.
Give us a website where we can learn more about the Harmony valve.
Of course. I would recommend that all patients initially, have a conversation with their cardiologist about what their best treatment options are. But for both care providers and for the patients, Medtronic has developed a website that's www.harmonyvalve.com, and they can learn a great deal more about the information I presented and learn more about who locally in their area is being trained and is certified to put this valve in.
Dr. Jones, always a pleasure. Thank you so much for returning, and I'm looking forward to our next conversation. Thanks.
Thank you, Neil. Good to talk to you again as well.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with returning guest, Dr. Tom Jones. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.